guys, it's your boy X back at you again with another video today. And today we're going to be talking about tips for diabetic tattoo clients. The way I'm going to outline this video is first we're going to talk about the different factors that can contribute to causing problems for a person who's looking to get a tattoo when they have diabetes. Then we're going to talk about A1C history and A1C levels. And then we're going to talk about common problems that can arise for a person with diabetes and less likely problems that can arise for a person that has diabetes. So type 1 and type 2 diabetic clients can suffer from similar tattoo problems when it comes to healing a tattoo and problems that they experience during the tattoo process. And probably a big contributing factor to that would be understanding their A1C history. Pretty much what A1C test is a blood test that determines what your blood glucose levels are over accumulation of a couple of months. So if you have high A1C history, that's not a good thing, and you want to talk to your doctor for clearance before you move forward with getting your tattoo. If you have good A1C levels, then you're more likely good to go and you can move forward with your tattoo. So let's go into the first problem that a person with diabetes can experience when they're looking to get a tattoo, and that would be hypoglycemia. In other words, that means your blood sugar can go low. A good average blood sugar should be somewhere around 70 to 120. A good way to mitigate hypoglycemia during a tattoo, if it's going low, stop, take a break, eat 15 carbs, wait about 15 minutes, check your blood sugar again, and then if you're not regulated to where you should be, repeat that process until you get to where you need to be. If you know that you have a tendency for your blood sugar to go low, maybe eat a surplus of carbs beforehand to account for the hypoglycemia so that you're not going to critical levels, because if you get down to critical levels, it could be likely that you'll pass out and not wake up, and a tattoo artist is not medically trained to deal with a situation like that. So no matter how good your A1C levels are, it's also not a guarantee that you're not going to pass out. So keep that in mind, and just make sure you have some food with you that you can help to regulate your blood sugar if you need it. The second problem that you can experience would be healing, and the more common problems with healing would be that diabetics, they tend to heal slower because of peripheral neuropathy. And in other words, that means your blood vessels are damaged due to the diabetes. So diabetics are also, they're more likely to develop diseases that can lead to poor circulation, as well as just generally their bodies can heal slower. And that can also affect the tattoo, which can make that heal slower or not as well as a person that does not have diabetes. And then finally, the last thing that can happen, which is more rare, would be an infection that would lead to an amputation due to that person being in a poor physical state, potentially them potentially not being diagnosed with diabetes and not knowing that they have it, and that could cause something like that. But it's important overall to make sure that you use your past wound history as a reference for how your tattoo is going to heal. So if your wounds heal fine, it's likely that your tattoo is going to heal fine, and vice versa. If your wounds aren't healing fine, maybe you want to see a doctor and make sure you're getting everything in order health-wise before you move forward with the tattoo. It's always good to talk to a medical provider about the risks that are associated with diabetes and with tattoos before going in and asking your tattoo artist anything. So keep that in mind, and I hope that helped. I hope you guys found this informative. If you did, leave a like, leave a comment down below, and don't forget to subscribe to the channel for future content from me. I hope you guys enjoy this. I'll see you in the next one.